So in our air itself, we have a lot of different gases. We have 78% nitrogen, 21% oxygen roughly, and then we have other gases, even pheromones are in the air. So we have to take this stuff in, and all of that contributes to pressure in the system. And that partial pressure determines the rate of this gas diffusion in the alveoli. So what happens is, at rest, you're going to have, let's kind of draw this out. So if this is your alveoli and this is your capillary, we're going to find out that in the capillaries, we're going to have red blood cells, of course. Red blood cells. And they're going to be high in CO2, right? So they're going to have a ton of CO2 in them. And that's going to be high. And they're going to have a low amount, and here we're going to have CO2, and it's going to be low. And it's going to be low. So you can already see that with diffusion, what's going to happen is the red blood cells are going to give up the CO2. And remember, with diffusion, things go from high to low till they get to equilibrium. So the first thing that we'll see is that CO2 will go this way. And that's going to be into the alveoli. Okay, so we have that down, but we have another thing going on. We have in our alveoli, and we have our capillary, we have one other gas, and that is going to be O2. So we have O2 and O2. And in our capillaries, O2 is going to be low because it's returning from the pulmonaries to the lungs. We've already used up that oxygen, so we're picking up all that CO2 from all those tissues, bringing it to the alveoli to dump it, but we also need to pick up oxygen, and the alveoli is going to have a high amount of oxygen. So what's going to happen simultaneously is that the red blood cells, RBC, red blood cells, are going to pick up the oxygen as it comes in and move it. And this is going to happen at rest at about 0.25 milliseconds, so 1/4 of a second. During exercise, this has to happen even faster because you're exercising so much and doing cardio, and we're going to have to do this at a much faster rate to get it to go to our alveoli. So what are the factors that influence this gas exchange? There's something called Henry's law, and that's the amount of gas that's dissolved in water is determined by its solubility in the water, and it basically helps determine concentration of air. There's concentration gradients, which is going to be areas of high concentration of one gas and low concentration of the other. And we kind of talked about that with the alveoli and the red blood cells having that difference. There's gas solubility, that CO2 is 20 times as soluble as O2. So it's going to be quicker to move into liquids, it's going to be quicker to move into other items. That's why we can pick it up in red blood cells so quick. It's going to help us when we pick up the CO2 and drop off our oxygen. This is going to be huge for gas loading. Membrane thickness. The membrane of the alveoli has to be thin. If it was super thick, then we wouldn't be able to do any of this gas exchange very effectively. Or what would happen is red blood cells would have to sit on one side of that cell for maybe an hour until that gas exchange occurred and then move on. And of course, you couldn't do what you are, you'd be dead. Membrane surface area, we have about 100 mils of blood in the alveoli capillaries spread over 70 meters squared. So that's basically saying 100 mils is a really small amount. If you ever put it into a graduated cylinder, you'll see. And it's basically spread over all these capillaries so it can quickly do that gas exchange, move it into the into the lungs, move it into the heart, and then move it around. So if you have 2 lungs, you're going to be able to do 200 mils of blood at the same time and be able to do that. Ventilation or perfusion is just the good ventilation for this. If you have an area of bad ventilation, it's going to be harder for you to do this. Oxygen transport, so the key here is going to be red blood cells. So 20 mils of, and don't even worry about these numbers, but what I want you to know is that the majority of the O2 is going to be bound to hemoglobin. Some of it's going to be in plasma because you drop it, and there's still going to be a little bit of gas exchange with that liquid. But basically, almost 99% is going to be in hemoglobin, and we know hemoglobin's in red blood cells. So it turns out that every hemoglobin can hold 4 oxygen particles. And we know that every red blood cell has 250,000 red blood cells, hemoglobin, which means that every red blood cell can hold 1 million oxygen particles. And we're basically going to be bound to more oxygen at this point than CO2. And we have an oxyhemoglobin dissociation curve, which we're going to see in the next 2 slides. And it's basically the relationship between hemoglobin saturation at oxygen versus CO2, which you'll see soon. After binding with O2, the hemoglobin changes shape to facilitate more oxygen to be picked up. That's positive feedback. And as it drops the oxygen, it's going to change shape again, and that's going to help facilitate more CO2 pickup. So here we have the percent O2 saturation. So 100%, this is going to be 1 red blood cell with, 1 million O2 particles. And then this is going to be the amount of oxygen that we can have. And you could see over a small amount of time that as we start to pick up our oxygen, it's number one, very quick. At rest, you can see it happens pretty quick. Just on its own, in the lungs, it's going to happen a little faster. But let me kind of show you this one because it's a little better. And basically, this would be a red blood cell that has no oxygen on it. This would be a red blood cell with a lot of oxygen on it. And what happens is we can quickly start to change the shape of that red blood cell so the hemoglobin changes, and in a very small amount of time be at a point where we're really facilitating a lot of O2 pickup and be at saturation. And this is happening in milliseconds. So you could see a red blood cell going past the alveoli, picking up all these oxygen particles and dumping off CO2. And it's just because it has an affinity to pick up the oxygen when its hemoglobin is a specific shape. But our body, the red blood cell, does all the job after this. It's going to do this thing called oxygen unloading, which means, yeah, you've got all this oxygen in this hemoglobin, so what? How are you going to dump the oxygen off the hemoglobin? There's 3 effects that does this. So number 1, tissue oxygen. So active tissue has decreased oxygen and more oxygen is released, which is just a fancy way of saying that when you're going past tissue, we're going to go ahead and pass some tissue that has low oxygen, and we're going to dump our oxygen off because of it. And how we're going to know that it has low oxygen is because these guys will have a high amount of CO2 because they've been active. And because of that, our red blood cell is going to go, aha, there is a bunch of CO2 here, so we're going to dump our oxygen and we're going to keep moving on. Another thing that can facilitate this dropping off of oxygen is temperature. If you have cells that are moving around a lot, they're going to create friction. They're also going to increase in temperature because they're doing some work, and that's going to facilitate oxygen release. And also, this will be another sign that there's going to be a high amount of CO2 in the area. And then Bohr's effect, which means active tissue has more CO2, which raises the hydrogen ions, which makes it more acidic. So lower pH. Pretend that arrow looks normal. And lowers the pH, more oxygen is released. And again, It's also thinking that there's a change in the pH because of CO2 levels, and that's why we're dumping it. Really, these are three ways of saying almost the same thing. We have some tissues that are active. They're going to be producing a bunch of CO2, and they're going to have a high O2 demand. They're also going to be warm, which is also going to facilitate this movement, and they're going to be lowered in pH, which is also going to facilitate this O2 dumping. Great. Well, now what we'll have to do is we'll have to talk about how we adjust based off of exercise. We know that normal body temperature is somewhere around 38 degrees. As you start to get into hotter environments or you start to get into an exercise mode, you're going to quickly start to dump that oxygen faster, and it's because your body needs it more. If you ever heard of those situations where people fall into the ice and their breath rate slows, well, look right over here. At 10 degrees Celsius, 20 degrees Celsius, look how slow muscles start to work, and look at the oxygen demand, how it changes. And this is just metabolic rates of tissues. If you're warmer, of course, your metabolic rate's going to be needing more. If you're colder, almost frozen, your body's starting to pull blood vessels in, blood in, to kind of keep your core going and just keep the necessary stuff going, and you're going to have a lower demand. Let's look at it with just pH. You can see that if we're at normal pH, which is like 7.4, there's going to be a normal amount of O2 exchange, O2CO2. If we have lowered our pH, we're going to go ahead and start to dump more oxygen because we feel that these cells are producing more hydrogen ions, which means that they are decreasing the pH, which means that there's more CO2, and that's going to facilitate that too. If you're more sediment and your pH went up a little bit, there's going to be less demand for that dumping. If we keep going, we have the adjustment of metabolic needs, and that's going to be that loading that we talked about. And it's just talking about how here's a better picture. Here's your red blood cells, so this is going to be the capillaries. Here's your tissues. Here's your alveoli. Here's your red blood cells. Here's your tissues, and they are producing waste, and that's going to get picked up by CO2 here, and we're going to go ahead and dump O2 to these tissues. When the same red blood cell comes to the alveoli, so here's the capillaries, here's the alveoli itself, we're going to see that CO2 will get dumped to the other side.